Hi everyone. I'm so excited to begin my capstone experience and to talk a little bit more about the process. I've created a PowerPoint presentation that I would like to share now. So the capstone experience is a self-directed project completed by the third year OT doctorate student to continue to grow inter and intraprofessional skills. It's based off of what we want to learn and want to know more about, and also what our site is interested in looking more into to continue to promote the patient experience, treatments provided, and the competence of clinicians. So thus far, I have begun my systematic review. I completed the search string to find my articles, extracted data, completed my risk of biases and grade table, completed the systematic review and had it peer reviewed. I'm currently working on having it reviewed by a faculty advisor and completing my needs assessment, all of which will be done by the time that I begin my capstone experience. So, what is the difference between a fieldwork educator and a capstone mentor? A fieldwork educator is someone who provides direct supervision to the OT student throughout their fieldwork experience. They take on the responsibility of the documentation, interventions, and billing provided by the student. They evaluate the skills of the OT student to establish competency to be a practicing clinician. And also they facilitate opportunities to meet not only the site's objectives, but also the learning objectives set by the university program. The capstone mentor, on the other hand, is someone who provides support, advice, and transfer of knowledge and experience to the student to continue to grow their skills. They take on the role of a mentor and a consultant and an advocate to continue to collaborate with the student on the learning objectives so that both the student and the capstone mentor are focusing on what they want to learn more about. So my capstone specifically, I'm interested in working with the pediatric population with a diagnosis of autism spectrum disorder, and I'm interested in the intervention of aquatic therapy. Sleep is an outcome that we haven't looked at yet, so I'm interested in looking more into how aquatic therapy can impact sleep behaviors for this population. Areas of interest include facilitating and evaluating sensory assessments and how sensory processing can impact engagement in daily activities, and continuing to implement family-centered care, facilitating aquatic therapy sessions to address sleep behaviors, and implementing sleep sensory-based interventions and educating other interventionists on how to provide these sensory interventions to continue to support our patients. So, my definition of a capstone mentor is someone who is supportive of the learning process, is approachable and open to questions as they arise, very understanding, engaging in open communication, providing feedback to the student to continue to grow their skills, open-minded to new ideas and learning something new, a role model for the field, an advocate for our patient, and an expertise in their work. Someone who's willing to pass on their knowledge and experience to the next generation of clinicians, and someone who's just interested in continuing to expand our understanding of the population and intervention that we're focusing on. My role as a mentee is to be someone who is committed to growing as a student, future clinician, and as an individual, being flexible and prepared each day, open-minded to new ideas and new experiences, taking in and applying feedback, engaging in open communication, asking questions as they arise, asking for help when needed, and continuing to just want to learn more and be very focused on contributing to an overall very positive experience. My weekly agenda that I hope to establish with my capstone mentor is each week addressing what went well and what was a little bit more challenging, reflecting on the progress towards midterm and final objectives. This is something that I want to take on as my role as a mentee is being very self-directed and advocating for myself. So part of this is individually tracking my progress, and being able to communicate that to my capstone mentor. I also want to establish goals for myself each week. So at the end of the week, reflect on my progress towards those weekly goals and set goals for the upcoming week to continue to track my progress towards my learning objectives. And I just want to really focus on asking for feedback and suggestions about situations that arose so that I continue to grow my skills as a clinician and as an individual and just continuing to find ways to better myself. So I'm really excited to begin my capstone experience, and thank you so much for listening to a little bit more about my perspective on the experience and my process specifically. Thank you.